In this section, we will discuss on the image quality criteria of chest X-ray. Firstly, we will touch on the evaluation of positioning for PA chest X-ray. To assess the correct positioning, we need to evaluate if there is any presence of rotation in the PA chest radiograph. We can detect rotation by comparing the distance from the vertebral column to the sternal ends of the clavicle. On a rotated PA chest, the sternal clavicular end that demonstrates the most vertebral column superimposition represents the side of the chest that position closest to the IR. Secondly, we can measure the length of the left and right corresponding posterior ribs. The side that demonstrates the shortest posterior rib length represents the side of the chest that position closest to the IR. If there is presence of rotation, we need to improve the patient's positioning by rotating the patient toward the opposite side until the MSP is perpendicular to the IR. Next, we can assess the tilt of mid-coronal plane based on three things, which are measuring the amount of apical lung field seen above the clavicle, looking at the superimposition of manubrium with thoracic vertebrae, and evaluating degree of lung and heart foreshortening. If the patient is not tilted, approximately 2.5 cm of lung apex is visible above the clavicle. Manubrium is projected at the level of fourth vertebrae, and lungs and heart appeared without foreshortening. Tilt of mid-coronal plane may happen in two ways, which are tilt forward and tilt backward. For tilt forward, more than 2.5 cm of lung apices is demonstrated above the clavicle. Besides, for tilt forward, the manubrium is situated at the level of fifth vertebrae or lower. On the other hand, the manubrium is superimposed between T1 to T3. For both tilt forward and backward, lungs and heart will appear foreshortened. If there is any tilting, we need to move the patient towards the opposite side until both shoulders are equidistant to the bucci. Besides, we need to ensure that the central ray is perpendicular to the IR as well as to the mid-coronal plane. Next, to indicate correct positioning for PA chest, we need to look at the position of clavicle. If the medial ends of clavicle are at the same horizontal plane with the lateral ends of clavicle, that indicates the correct positioning. This is accomplished if the patient depress and relax the shoulders during the procedure. If the shoulder is not depressed, lateral ends of clavicles will be elevated. Next, the scapula and humeri should be projected out of the lung field. You may see the scapulae superimposing the superolateral side of lung field in an inaccurate elbows and shoulder rotation. That will indicate the incorrect positioning of the patient. In addition, for PA chest X-ray, we need to evaluate on the full lung aeration. For incorrect inspiration, 10 to 11 posterior rib should be seen above the diaphragm. E. Exposure factor. 。 . 。 . 。 . 。 . 。 . 。 . . 。 . . 。 . 。 . 。 . 。 . . 。 。 。 . . 。 。 . 。 。 . 。 。 . 。 。 . 。 。 . 。 。 。 . 。 。 . 。 . 。 。 . 。 In order to check the adequacy for contrast and penetration, the thin structure that should be visualized is vascular lung markings, while the thick structure that should be seen is the BCO of thoracic vertebrae and posterior ribs behind the heart. For assessing density of PA chest radiograph, the thin structure that should be seen is the air-filled trachea, and the thick structure is the BTP of upper thoracic vertebrae. Next, let's learn how to differentiate between AP and PA chest radiograph. In AP chest X-ray, the spinous process of C6, C7 and T1 is seen at the inferior aspect of its vertebral bodies. Whereas, for the PA chest X-ray, the spinous process of C6, C7 and T1 will be seen at superior aspect of its vertebral body. In addition, in AP chest X-ray, the vertebral bodies and intervertebral displaces of C6, C7 and T1 are seen without distortion. On the other hand, for PA chest X-ray, the vertebral bodies are appeared distorted and the intervertebral displaces of C6, C7 and T1 are closed. There is also different depiction of posterior ribs seen above the diaphragm for AP and PA chest X-ray. For AP chest X-ray, at least 9 or 10 posterior ribs should be seen above the diaphragm, whereas for the PA chest X-ray, at least 10 or 11 posterior ribs should be seen above diaphragm. In an AP chest X-ray, patient is usually in a supine or semi-erect position. Therefore, the diaphragm is unable to shift to its lowest position because the abdominal organs are compressed and pushed against the diaphragm. This is why only 10 or 9 posterior ribs are demonstrated above the diaphragm because the lungs are not fully aerated. In next section, we will learn how to analyze the PA chest X-ray based on Paceman method.